in our parallel technical sessions. So we're going to be covering a wide range of things that you've already seen that we have collected so much data on so many different topics, and you will have to choose which session that you will be joining. So we will have two sessions, one after this session and one after lunch, and in each session we will have 3 breakout rooms. So in the first session, in the first breakout room, we have the topic of diabetes. We will be covering the diabetes prevalence, diagnosis, treatment and control of diabetes and hypertension. And this will be presented by Dr. Ravi. So we have a lot of diabetes in Sri Lanka. Nearly 1 in 4 adults have diabetes, which is almost one of the highest prevalences in the world. And 1 in 3 adults who have diabetes don't even know they have it. Dr. Ravi will also cover something called the treatment cascades, which looks at the diagnosis, treatment and control of both hypertension and diabetes. So with hypertension, I presented before that 1 in 3 adults have hypertension, and half of these people do not know that they have hypertension. And so this cascades analysis is a sort of indicator of our health system performance, because what we are looking at is, of all the people who have hypertension, how many have been diagnosed? We found only 53% of these people have been diagnosed, and how many of these people are aware? Only 50%. How many of these people are on treatment? Only 45%. And then finally, control. Only 20% of people with hypertension have controlled blood pressure. So this is a way to look at our health system performance. In the same session, there will be a presentation by Dr. Manjula Nugawella, who will describe the SLHAS and University College London Diagnose DR project to detect diabetic retinopathy using AI-assisted handheld cameras. So fieldwork will start in the latter half of this year with a pilot study at the National Eye Hospital, and we plan to do fieldwork at clinics provided by consortium partners. So the main aim of the study is to assess the feasibility of using these cameras to screen for diabetic retinopathy in lower level facilities. And it's a project that we're doing with Professor Sobha Priyasad and Dr. Manjula at the University College of London. The next presentation in this session will be by Ms. Sarasi Amarasinghe. She's going to describe all the data that we have available, some of which has not been analysed yet, and we're looking for people to give us proposals to analyse this data. So we have blood test results, we have anthropometry and body composition results, and measures of aging, such as hand grip, gait, speed and balance. In the second room, in the same parallel session, we have the food and nutrition session, which is a very important topic at this point of time. We do encourage people to attend this session. The first talk will be by Dr. Renuka Jayathisan. So she and her colleagues in the MRI did some very important work on salt, potassium and iodine intake estimations. So as we described before, they did 24-hour urine collections to estimate these, and they also were able to match the 24-hour urine results to the spot urine test, and they could validate equations to predict the salt, potassium and iodine intake from a spot urine sample, which is a lot more convenient to take even in clinics or in surveys. So Dr. Renuka will present these findings via video. And what she found was that our Sri Lankan population has a high intake of salt, low potassium intake and an optimum iodine intake. She's also published this paper in the Journal of National Science Foundation, Sri Lanka. This session will be followed by a talk by Dr. Senal Veerasurya from Peradeniya University, where he has done a validation of the food insecurity experience scale in Sri Lanka. So this FIES questionnaire is an experience-based metric of food insecurity and food insecurity severity used by the Food and Agriculture Organization of the United Nations, or the FAO. And as we know, there's a lot of discussion in the media and the parliament and everywhere about how bad our food security situation actually is. So Dr. Senal has done an analysis using our Wave 2 telephone survey data, which is data collected during COVID and then the subsequent economic crisis, to quantify the level of food insecurity in our country. And this will be followed by a presentation by Dr. Ravi, where he will discuss our current plans for important research to truly quantify this food insecurity problem in our country. The third room in this first session is on quality of life and physical functioning. The first presentation will be by Ms. Nishani Gunawardena, our ex-SLHAS alumni. So she has done some very interesting work using our asthma data, where she takes responses from the European Community Respiratory Health Survey questionnaire, and she has developed a tool to predict the probability of having asthma based on self-reported symptoms. We have another presentation by Dr. Chaturani Sigera, who will be looking at the hand grip strength in Sri Lankan elders. So hand grip strength is a biomarker for aging, and this analysis is based on data collected from a grip strength dynamometer, which is this gadget here, and it measures the hand grip strength in kilograms. So she'll be presenting her findings. The next presentation is on population norms and a disutility catalogue for chronic conditions in Sri Lanka using the EQ-5D-5L questionnaire. So in this we will be showing what the utility scores for people is based on different individual characteristics. And the last presentation in this session will also cover the large amount of data we have that's related to respiratory functioning. So we have spirometry data, we have data for COPD estimation, we have data for asthma, which looks at the prevalence and severity and control of asthma, and we also have some data on indoor air pollution as well. After lunch, we'll start our second parallel session. And in the first room, we have a session on cardiovascular disease. The first presentation will be on the prevalence of ischemic heart disease, where we find that the prevalence in Sri Lanka is actually likely to be far higher than we've thought from other surveys. The second presentation will be on the cost effectiveness of modifications to the Sri Lankan CVD risk screening program. So we will look at the costs and impacts of changing the age group screen, changing the risk threshold for statin treatment, adding treatment of a lower blood pressure threshold, and giving statins to diabetics. The next presentation in that session will also look at the opportunistic screening for hypertension, diabetes and CVD risk in existing healthcare encounters. So Sri Lankans have a lot of doctor contacts, with an average of 6 contacts per year. It's one of the highest in the world. And we found that 30% of SLHAS participants with an undiagnosed condition had actually visited a doctor in the past 28 days. So we did this hypothetical exercise to look at how many more people we could diagnose if we could screen a proportion of these people who visited a doctor. And to wrap up that session, we will have a description of the data available. So we have ECG data on every participant. We have physical activity data and also data on that can be used to estimate obstructive sleep apnea in our participants. In the second breakout room, we have a mental health session. So the first presentation will be by Mr. Yubi E. Sasanka from Peradeniya University, where he is going to compare the Sinhala and Tamil PHQ-9 questionnaires. So he has done an analysis of the psychometric equivalence of the Sinhala and Tamil PHQ-9 questionnaires across demographic groups. And this is PHQ-9 questionnaire is used for depression screening. This will be followed by a presentation by Professor Shamala Kumar, where she looks at the prevalence of depression in Sri Lanka in pre-pandemic times, so during our wave 1 in 2018 and 19. We will have a presentation by Dr. Abhi Devanayagam from UCL, where she has done analysis using wave 1 and wave 2 data, spanning a period of Easter Sunday attacks, COVID-19, the lockdown, and economic crisis. And she looks at mental health of our participants and healthcare use and access during these times. And this session will wrap up with a presentation by Ms. Ishwari Sivanyanam, and she will cover all the data that we have available. Most of this has not been analysed yet. We have extensive data on smoking, on alcohol use, and a wide range of data using standardised questions such as PHQ-9, DAS, the UCLA-5 for loneliness, cognition, and control happiness. And this is in the third breakout room, which actually reads C2. We have the tracking of COVID-19, vaccination, testing, and public opinion in a time of crisis. So the first presentation on this will be by Dr. Ravi. He will be looking at COVID-19 vaccination, testing, and symptoms, and an in-depth exploration of the phone survey methodology. The results from the analysis of the W2 phone survey during the COVID-19 pandemic will be presented on unmet need for healthcare, on vaccination and vaccine hesitancy. Was there any vaccine hesitancy in Sri Lanka? Inequalities in vaccine coverage and inequalities in COVID testing coverage. The next session will be covering the Sri Lankan Opinion Tracker Survey. So those of you who follow us on Twitter will be familiar with our work over the past year that uses the Sri Lankan Opinion Tracker Survey, or SLHAS, to track consumer confidence and political opinion in a nationally representative sample. We also have extensive data on what voters want in terms of healthcare, with many voters wanting, for example, increased spending on medicines over price control. And this session will wrap up with a presentation from Ms. Sachini Fonseca, who will present some analysis that she did on mortality trends during COVID and the availability of COVID data. So we have an analysis of self-reported CVD events in our Wave 1 participants when we contacted them in Wave 2. We also know which participants have passed on since we met them. And we also have a wide range of COVID-19 data which she will describe. At each session there will be a Q&A session at the end. We welcome lively debate and feedback. There will be data briefs available at the sessions to summarise what data is available and how you can get involved in analysis. And we welcome proposals to analyse data and get involved in SLHAS. And finally, I want to take a minute on behalf of the SLHAS team to thank all of the people involved in the study. The field staff, some of whom are here today, our research staff, the MOH staff, of course our SLHAS participants who gave up their time and effort, and the many, many people who participated and helped along the way. Thanks.